Anxiety can come in many different types, and one specific type of anxiety disorder is social anxiety disorder. Now, this can be very debilitating, and the best way to try to overcome social anxiety disorder is seek help for it. Sometimes people with this condition are so impaired that they won't seek help for their mental health problem. And really what separates social anxiety disorder between other types of anxiety is not as much the social component as much as it's this fear of being criticized or this fear of being embarrassed in social situations. Because many people can have anxiety, and anxiety can get worse in social situations, especially around crowds or long lines or being in public places. But social anxiety disorder in particular, people have this fear of criticism or fear of being embarrassed by others that they will tend to avoid people altogether. Now, how to overcome this? Well, from a psychiatric perspective, there are some medications that can help. One of the most studied medications and most effective medications for this disorder is sertraline, also known as Zoloft. And typically with anxiety, it's going to take higher doses to have some relief. But Zoloft can help decrease the intensity of the anxiety feelings that come from these situations. Now, another medication that's not specifically indicated for social anxiety disorder, but can help, is propranolol. Propranolol helps with a lot of the physical feelings of anxiety, like your heart races fast, trouble breathing, shaking, clammy, and it's often used before people give a performance or a public speech. And so in social situations in which people may notice anxiety gets worse, propranolol may help to relieve some of those symptoms. Other medications that can be used as needed for anxiety include hydroxyzine, although this can be a little bit sedating for people, so it may not be the best option. Then also buspirone, but buspirone is more indicated for generalized anxiety. So all these medications I've talked about in previous videos. And so you could search for that for more information about those specific medications. But in conjunction with medications, talk therapy is going to be an essential attribute to addressing social anxiety. And again, some people with social anxiety are so afraid or so fearful of social interactions that they won't even seek treatment from a professional. But that's an important first step to try to overcome in order to get this handled. And there are many different approaches in therapy that one can do. And I think it's also important to note that social anxiety is a little bit different than other types of symptoms that can mimic social anxiety disorder. For example, post-traumatic stress disorder is when someone has had like a severe traumatic experience, and they may get increased anxiety in social situations. They may have difficulty trusting people. And so that might mimic social anxiety disorder. Also, people with just generalized anxiety, they may worry about anything and everything, and perhaps it gets worse with certain people or certain social situations. That may mimic social anxiety disorder as well. And sometimes people can get conditions such as a panic attack or panic disorder, in which they get these intense periods of anxiety, feel like they might die, or the impending sense of doom. They might feel like they're having a heart attack. And a lot of times benzodiazepines are going to be helpful in these cases. And so that could get perhaps misdiagnosed as like a social anxiety disorder or vice versa. So I think in conclusion, it's going to be important to talk with a medical and mental health professional about the symptoms one experiencing to really clarify what the diagnosis is, because that's going to dictate the treatment options.